Okay, so today we're going to go over some mobilizations to improve external rotation for a patient with adhesive capsulitis. We're going to work on external rotation because typically that's the most limited in a patient with adhesive capsulitis, just because it does follow that capsular pattern. We are going to focus on a posterior glide today, just because there are several studies, including some in the clinical practice guidelines, that indicate a posterior glide may be more effective for improving external rotation than an anterior glide. And typically we do an anterior glide because that follows the arthrokinematics. But really it's up to what you see in your evaluation. So if the patient's presenting with a lot of tightness in the posterior direction, maybe the posterior glide is going to be more beneficial. So that's what we're going to demonstrate today. So you're going to have your patient in supine, and I typically like them to kind of angle off the plinth just a little bit. That way you don't have to worry about supporting the hand, and you can go ahead and stabilize at the scapula. So you're going to take up the slack and make sure the meat of your hand is just on the humeral head, and you're just going to apply a posterior directed force. So initially you can start with those grade 1s and 2s, kind of ease them into it. That can help relieve some pain. But eventually you're going to want to work up to that grades 3 and 4. That's going to really help you increase the range. So you can really get to the end of that tissue range and then do a small amplitude for your grade 4s. And that's it.